Hello, everyone, and thank you for joining us today. My name is Derek Hunter from CMS's Division of Value-Based Incentives and Quality Reporting, and I will be moderating today's forum. This bi-monthly forum aims to provide national stakeholder organizations, specialty societies, health IT organizations, and EHR vendors with information relevant to CMS's Quality Management and Value-Based Incentives Group. Next slide, please. Our program today will include Medicare Promoting Interoperability Program updates, eCQI Resource Center improvements, and Quality Payment Program updates. We will have a question and answer portion once all presentations have concluded. Please note, to ask a question, you can either submit your questions using the chat feature or raise your hand and CMS will unmute your line. For those dialed in via phone, you must have your audio pin entered. If you're listening through your computer speakers and want to ask a question, you must have a working microphone. Mr. Morgan, I will now turn it over to you for your presentation.
Drew, you may be on mute.
Yes, I was. Sorry about that. So I'll start all over again. So good morning or good afternoon, depending on where you are today. I'm going to just do some brief updates on the Promoting Interoperability Program. Next slide, please. So just a reminder that for program year 2020, the reporting period ends this Thursday at 11:59 p.m. For the 2020 reporting period for the PI program. So eligible hospitals and CAUSE, if you're going to attest your reporting for PI, you must do that through QualityNet Secure Portal. And make sure that you also get all your eCQMs uploaded either through the online portal or through the QRDA file upload process. For more information about registration and attestation, you can visit our page, our CMS page. Next slide, please. I'm just going to give a quick update on for the 2021 or the 2022 payment adjustment period for eligible hospitals and CAUSE. The hardship submission window will be opening up on May 1st this year and will run through the summer. So if you were not able to attest for some reason or you did not pass PI for the 2020 reporting period, you can file a hardship. And with that, I'll hand it back over to Derek.
Thanks, Drew. Dylan Podson will present next. Dylan.
Thank you, Derek. Thank you, Drew. Good afternoon. My name is Dylan Podson, as you heard, from the Medicare Promoting Interoperability Program. And today I'm just going to briefly address two different quick but relevant topics. The first is regarding the annual call for measures period, and the second will be concerning recent updates to the program's CERT requirements. Next slide. First up is an announcement for the Medicare Promoting Interoperability Program's annual call for measures. If you've been with us in the program in years past, I'm sure you're very familiar with this, and I guess I'm glad to report that it's remained, relatively unchanged from previous years. The opportunity for participating providers to submit their ideas and/or proposals on new or expanded measures, it opened last Thursday on the 25th. And it will run through June 30th. Please remember that in order for submissions to be considered for future IPPS rulemaking and possible inclusion to the program, the submitted forms must be thoroughly completed. So we'd encourage you to do the most amount of research and provide the most amount of content for us to analyze. As you'll see on the slide, there's an email address where submissions will be received by Ketchum and then subsequently reviewed by CMS. So again, we'd encourage the participating community to spread the word and get these in without delay before the end of June. We refer back to the submission documents posted online for a much more detailed explanation of the required standards. But regardless, we appreciate you taking the time to brainstorm and share your promoting interoperability measure considerations for eligible hospitals and CAUSE. Next slide. So transitioning a bit to a different topic, it's something you'll continue to hear more about throughout 2021 and 2022, but hopefully it's already been introduced to y'all for just inclusion on your radar. As an introduction, however, we'd like to continue this sort of campaign of public awareness on the updated certification criteria, which was first established in the ONC 21st Century Cures Act final rule, and then finalized to be incorporated with the Medicare Promoting Interoperability Program in last year's calendar year 2021 Physician Fee Schedule final rule, also known as PFS. We understand that this is a bit interesting, a bit unusual, and that it may have caused some initial confusion, as our policies, of course, generally would be contained within the IPPS rule for eligible hospitals and CAUSE. However, we felt that including a rider, an add-on rider for public notice in the PFS rule that has already gone out now would be the earliest way to reach the stakeholder community and to maximize the amount of time that providers would have to review the content prior to these changes going into permanent effect, which we'll now kind of briefly go over, and as you'll see on the slide here. So while we encourage providers to take a closer look at all the detailed explanations included in both the ONC 21st Century Cures Act final rule and the calendar year 2021 PFS final rule, the various changes such as the US CDI replacing the CCDS standard, they're relatively minor in scope. They don't take a huge kind of lift or overhaul, which is why we're not considering this a brand new edition. So we're not going to be calling it 2020 edition or 2021 edition, anything like that. However, the update does come with its own requirements and changes. So between now and December 31st, 2022, providers will have the option to use either their current existing 2015 edition of certified technology, which has been in effect for several years now. The other option they have is to use the 2015 edition Cures update criteria, which is described in those final rules. Or the third option is a combination of the two, a bit of a transition and merging of the two until kind of full implementation. However, that was between now and the end of 22. So beginning January 1st of 2023, all participating eligible hospitals and CAUSE must have ensured that their health IT vendors have successfully implemented these required changes such that they're actually utilizing this new 2015 edition Cures update criteria for the new calendar year. That would be for 2023. Next slide. Thank you. So the bullets here are just a couple straggler useful reminders to keep in mind, but they're consistent with previous cert requirements. For example, how just the functionality must be in place by the first day of a hospital's self-selected EHR reporting period, whenever that may be, but that the entire product must be ONC certified by the last day of the EHR reporting period. So given that that would be 90 days, whenever the 90 days come to pass, at the beginning of the 90 days, the first day, the functionality has to be working. However, it could be pending certification with ONC. And so the most important thing is just making sure that, as usual, again, this is nothing new, but that the certification would be completed by the end or the last day of the EHR reporting period that the hospital has selected. Again, as previously mentioned, we encourage providers who are either hearing this for the first time or for the fifth time to check with our CMS Medicare Promoting Interoperability Program website, especially as well as the two final rule links that you see here at the bottom for more detailed information. It goes into more of what I've spoken about today in terms of the requirements and the time frame and the transition period and things like that. So thank you for your time, and I believe I'll be passing things over to Jennifer with another agenda topic. Thank you.
Thank you. I'm Jen Seaman. I work with the ECQM Standards support contract for CMS, and I'm going to just provide some high-level information in regards to the standards update cycle. Next slide. So this is a high-level overview of what the process is to update a standard. We'll start always with a change request of some kind, a comment, an issue, or a harmonization with another standard that needs to be kept in sync. The standards contractor will then take that request and review the ask, determine options for solutioning, and present those to stakeholders. And as we are doing those reviews, we also dig into the impacts. So there are a lot of moving pieces. Are there other standards impacts? Are there tooling or timing updates or impacts that we need to address? We'll also frequently shepherd those standards updates through the approval process. Some of those go through HL7 update processes or coordination with work groups that contain stakeholders that would agree to a given update. And then we'll update the standard itself, whether that be making changes in a web-based IG, or perhaps publishing a new version, updating the Word document that supports the publication, rather, to make sure that that content is in line with the requested change. Once the standard is updated, then we also need to make sure that technical resources or tooling are also in sync with that change. So one example would be a QRDA IG has a change, and the schematron file or sample files that are published to end users have to also be in sync with that change. And then the final step being the publication or announcement, which is basically making the updated standard available for use to end users. So that is the cycle in a nutshell. I would say that these are high-level steps, and there are many times that they kind of overlap or take place concurrently. And so there's just a high-level overview. And I believe I am handing off to Edna.
Thanks, Jen. All right, so the next set of slides provides an overview of the Electronic Clinical Quality, or ECQI, Resource Center updates. We have some new content as well as site improvements, and we hope these will be beneficial to our users. So next slide, please. So the first item is the ECQM Annual Update Pre-Publication Document. This document is designed to help health information technology, IT developers, as well as eligible professionals, eligible clinicians, and hospitals and critical access hospitals, as well as ECQM implementers, prepare for the 2022 reporting performance period. So it includes the standards and the code systems that are used in the development of ECQMs for potential use in 2022 reporting. Next slide, please. So the current document is located either on the eligible professional or eligible clinician ECQM page. You do need to select the 2022 performance year or reporting year, and the document will be available on the implementation resources table. Next slide. So to navigate there, you're just looking at the ECQI Resource Center. If you're not familiar with the site, you're going to look at the ECQMs, and then either the eligible professional or eligible clinician pages will get you to the document. Next slide, please. In addition to the pre-publication document, we've also updated the ECQM standards and tools version chart. So that was updated in February. Along with the standards, this chart also provides the versions of the tools that were used to create, test, and support ECQMs for the CMS Quality Reporting Program 2022. Boy, that's a mouthful on the 2022s. All right, next slide, please. We'll show you a quick picture of the chart. Again, this is in the ECQI Tools and Resources, and you would select a reporting period, in this case 2022, and you would see the various versions and tools. And next slide. To locate this resource off the main menu, you're looking at Resources and Tools, and then ECQI Tools and Resources. Next slide, please. So a new item we have is the ECQM graphic. This was, the Resource Center has published this, and it was adapted from HL7 Quality Improvement Workgroup. The image really highlights the ideal iterative flow of evidence-based information from research to clinical practice and measurement to evaluating clinical performance and outcomes for healthcare organizations. So next slide, we'll take a look at the graphic. So again, kind of starting in the upper left-hand corner, we look at what comes out of research and public health surveillance, so what's actually happening in the field, how then we take that information and develop clinical practice guidelines and what should be happening based on what's happening clinically. And then another tool would be clinical decision support, helping to make things happen, clinicians and patient workflow in terms of that information flowing. And then lastly, we do look at measurement and analytics. And from that measurement, we get into reporting. So this is kind of the ideal ECQI ecosystem. We know that not all of these pieces are happening in this nice iterative flow, but you'll see more and more of this. There is some information coming out, I know, on some of the MIPS roadmap that shows a little bit of this kind of ideal state. So we did want to share that with you, and there's components of this graphic available on the Resource Center. So next slide will take us, I believe, to finding this document, and that is within the About portion of the menu, and then select About ECQI. All right, next slide, please. Additional information that we have provided, the new Measure Collaboration Workspace and ECQM Lifecycle graphic. This highlights when key components of the Measure Collaboration Workspace are to be used during ECQM lifecycle stages. Next slide. So if you're familiar, on the left-hand side is the traditional ECQM lifecycle, and on the right-hand side, we see the Measure Collaboration Workspace. And what we've done here is, so for instance, with specification, we're recommending that you would take a look at the ECQM Data Element Repository, and that would help with the specification cycle, point in that cycle. For testing, we're looking at the new ECQM clinical workflow as well as ECQM test results. For implementation, key modules to use would be the new ECQM clinical workflow and ECQM data element repository. And then for use and continuing evaluation and maintenance, the ECQM data element repository. And then conceptualization, looking at ECQM concepts as well as the new ECQM clinical workflow. We do think that there are components of the measure collaboration workflow that might be useful for perhaps all of the steps within a life cycle, but we have highlighted using the kind of 80-20 rule in terms of what we think is most important for end users. Next slide, please. To locate this graphic, by dropping down on the ECQM menu and the Measure Collaboration workspace, that first slide, or first page rather, if you scroll to the bottom of that page, you will find that graphic. All right, and one more final update. Next page, please. The Resource Center has updated the Engage in ECQM page of the Resource Center. This page allows you as an end user to select the user type you most associate yourself with, and a list of opportunities to engage appears. Next slide, please. So to find that, you locate the ECQM, or the Engage page rather, by navigating to the Engage section of the main menu, and then selecting Engage in ECQI. Next slide, please. You would, in this case, you see where it says, what user type do you associate with? If you select a user type, that could be eligible hospital, eligible clinician, health IT, payer, etc., and then hit apply, and you will see a list, again, of opportunities, ways for you to engage with the community, listservs that you can join to remain up to date on various aspects of ECQI. All right, and one final slide regarding contacting the ECQI Resource Center and Measure Collaboration Workspace. So we hope that you find these resources and improvements beneficial, and then we invite you to provide feedback or ask questions to the ECQI Resource Center by emailing us to ecqi-resource-center@hhs.gov. And with that, I will turn it over to the next presenter.
Thank you, Edna. Finally, Katie will provide a few quality payment program updates. Katie?
Great. Thanks, Derek. We can start on the next slide. And good afternoon, everybody. We got a few slides to go through here, and then I'm sure we'll open it up for questions. So thanks for hanging in there. I know it's a lot of information. So I'm going to give a few quality payment program updates. So first, we want to highlight that our merit-based incentive payment system, so one track of the quality payment program, MIPS. So our 2020 data submission period closes tomorrow, so March 31st at 8 p.m. So that's the most important date I'm probably going to give you today. Is if you haven't been able to submit your data yet and want to, you are able to log in at qpp.cms.gov and use your access credentials to log in and submit your data. And we have a whole bunch of resources on our QPP resource library that will help you to do so. So hopefully folks on this call have already been able to set up their QPP access credentials, their login through our HARP system. If you haven't, we have a QPP access user guide that walks you through the different steps to do that as well. And we also have a data submission user guide that's available on our resource library, as well as some videos that can walk you through how to submit data for 2022. Next slide, please. Thanks. Okay, so this is another big announcement we put out a little bit ago. So just we wanted to separate what we were talking about from 2020 performance year versus 2021 performance year. So for 2020, we are applying the MIPS automatic extreme and uncontrollable circumstances policy to all individual MIPS eligible clinicians for 2020. So if you participate as an individual clinician, you will automatically, there's nothing you need to do. This EC policy will be applied to you for 2020. So MIPS eligible clinicians reporting as individuals, you'll only be scored on performance categories for which you submit data. So this is very important. The act of submitting data lets us know that you are able to and want to participate in the program, and therefore we will score any data that is submitted to us. And for and also to make sure you heard the word individual in there, the automatic EC policy is only applies at the individual level. So if you report as a group, a virtual group, or an APM entity, we have also reopened our extreme and uncontrollable circumstances application that is open also through tomorrow. And I wanted to note that groups and virtual groups, so if you've already submitted data to us, that's great. And application will not override any data that has been submitted to CMS. However, if you are an APM entity, it's the opposite. The application overrides any data that is submitted to CMS. And for 2021, we did finalize in our 2021 final rule that that the EUC policy will apply to for COVID-related situations. So this is our application policy. We have not made a determination about our auto policy for 2021, but we will have our EUC application available for individuals that need that flexibility to have your performance categories reweighted to 0% due to the current pandemic. But that application and all of the details on how to submit will be available later this spring on qpp.cms.gov. And if you need any more information on what we've done or what we're doing in response to COVID, there is a link at the bottom of this presentation right here. But also, if you go to qpp.cms.gov, you'll be able to find our COVID-specific webpage. Next slide. Okay, so this just highlights our annual MIPS call for promoting interoperability measures and improvement activities. And I just want to make a distinction that this is a separate process from what Dylan walked you through earlier about the promoting interoperability or call for measures for the promoting interoperability program. These are PI measures specifically for MIPS, so the merit-based incentive payment system. So, but we have similar deadlines. So the call is open now and closes July 1st, 2021. And there is also a call for quality measures that is separate on a separate timeline, but we also have improvement activities open as well through July 1st. So again, there's a link in this presentation, but if you go to our QPP resource library, all the information about that process and what you need to know if you want to participate in the program that way is available on our website. Next slide, please. Okay, great, thanks. And then, so our data submission period for 2020 ends on the 31st. And then I also should note that once the data submission period closes, you will see preliminary performance feedback if you log into your QPP account as well. So also on April 1st opens our CAHPS for MIPS survey registration. And I forgot to add it to this slide as well, but also opening on that date is our CMS web interface registration. So those are the only two things that folks need to register for related to MIPS. And if you participated in the previous year in 2020 to administer CAHPS, you will not be auto-registered. Since there is a cost associated with administering the survey, we do not automatically register anyone, so you will need to go back in and register yourself if you would like to participate that way for 2021. That's a little different than our web interface. We do typically auto-register the previous year's participants in the web interface. And I know if folks are mostly aware now, If not, I'll flag it that this is the final year for our CMS web interface reporting option, and we will have additional information about the transition away from CMS web interface later this year. But if you are interested in participating in CAHPS for MIPS for 2021 or CMS web interface 2021, again, you have to sign in to QPP, and you can manage your access there. And we have registration guide that'll walk you through step-by-step on our QPP resource library as well. Next slide. Okay, one more thing real quick before we get to questions. Just wanted to flag that we are hosting next Thursday on April 8th, our first 2021 QPP overview webinar, and then we will have a series of additional educational webinars available in the coming months related to 2021 participation. So please be on the lookout for our listservs. If you haven't already signed up, please go to our website and do so. And we will also be posting registration for all of our webinars on the QPP webinar library page. So thanks everybody for listening, and I will turn it back over to Derek for any questions. Thanks.
Thank you, Katie, and thank you to all of today's presenters. We will now move on to the question and answer portion of the webinar.
Okay, great. And as a reminder, to ask a question, you can either submit your question using the chat feature or raise your hand and CMS will unmute your line. For those dialed in via phone, you must have your audio PIN entered. And if you're listening through your computer speakers and want to ask a question, you must have a working microphone. All right, and then we do have one question regarding attestation for the Medicare Promoting Interoperability Program. And they're just asking for clarity on whether they should be using the QualityNet system or the HQR site.
They would be using HQR.
Okay, yes, Drew, did you need me to repeat that, or were you just stating that they could be using the HQR site?
They would use the new HQR NG platform to report.
Okay, great, thank you, Drew. All right, and then moving on to our next question. This is a QPP related question. So this person is asking, is it possible to report PI and QPP as an APM, or is that just for quality?
Sorry, can you repeat the question, Joy?
Yeah, sure, Katie. And this person is asking, is it possible to report PI and QPP as an APM, or is that just for quality?
I believe it's PI as well, but if we can get that person's information, I just want to double check with the APM team.
Okay, great, yes. And if that questioner could please just enter their information into the questions box, we will relay that back to CMS. Okay, and then moving on to our next question, is CMS looking at applying ECEs for the full for the full calendar year 2020 performance period for the quality incentive program?
I don't think we have the right SMEs on for that specific program. I haven't seen that determination happen yet for the entire, I don't think that that's been made for the entire performance year as of right now.
Okay, thank you, Katie. Yes, we will be sharing these questions with CMS after today's webinar, so we can try and direct that to the appropriate contact as well. Okay, and then moving on to our next question, and this is on ECQM. So what is the time frame that CMS will be collecting information for ECQMs? Is it all year long, or is it inside a window of time? And I can repeat that question. I'm not sure if Edna might be able to answer that one, but we may need to take that one back to CMS as well.
Yeah, so the collection of the data from the ECQMs happens throughout the year, but the timeframes are specific to each individual quality reporting program. So I can't necessarily answer that generically. So you would have to, I would recommend actually going to the help desk for each of the quality program or the quality program that you're interested in and asking that question. So some of them are, for 1 quarter, some of those are for the full year, but it is depending upon the actual quality reporting program.
Thank you, Edna. Okay, and then moving on to our next question. This person is asking, how do I know if I report as a group or individual as it relates to the COVID relief?
So you would have to check with so whoever does your billing for your group. So if you're an individual, so I'm assuming that the person asking the question, and feel free to call in, participates in a group and aren't sure if your group is participating in the program as a group, or if you would just be required to report or participate as an individual. So you would have to check with your group, whoever does billing for your group, and ask them that question. So group participation is an option. Nobody is required to participate in that way. So if you are in a group, but your group decides not to submit data to CMS, then everybody in your group is considered an individual and would have the automatic policy applied to you. However, I recommend checking with your group, because if your group does decide to submit data, you as a clinician that participates under that TIN NPI combination would receive whatever score that the group would get for submitting data to the program.
Great, thank you, Katie. And we do have another MIPS 2020 reporting question. So if a provider wants to take the EUC hardship for COVID, they can simply not report anything and receive a neutral payment adjustment. Is that correct?
Correct. Yes. If you haven't submitted data to us and don't plan to, you are already covered under the automatic policy. And if you want to, I've had some folks ask if they want to be able to check somewhere that it says that. If you check your eligibility, if you go to qpp.cms.gov and use our eligibility lookup tool, you should, at this time, I believe it's been updated to include that flag that'll say that the automatic EUC has been applied to you.
Great. And our next question is regarding CERT. So they're asking, does updating to the 2015 edition criteria require that you must do a new security risk assessment and cannot address the new edition in a security risk assessment upgrade?
Hi, so no, there would not have to be a totally separate security risk analysis. That measure would just have to be performed the one time for that calendar year, and it can, as per previous years, the security risk analysis can be completed outside of the EHR reporting period. So it doesn't have to be within that 90-day, but it would still have to be done at least once to still cover the provider or hospital.
Thank you, Dylan. All right, and then back to another QPP related question. So for 2020 submissions, what if for the quality category, their claims data is already in, and if there is an EUC exception, will the quality category be reweighted?
Yes, you should still receive the neutral. It should be reweighted to 0. And I think we have a specific FAQ on the scenario related to claims. So I'm going to try and pull it up while we're asking other questions so I can follow up.
Great, thanks, Katie. Okay, so it looks like we have a few phone line questions. So Marilyn Wolf Diamond, your line is now unmuted if you'd like to ask your question.
I'm sorry, I didn't have a question. Not sure how that happened.
Oh, okay, thank you. All right, moving on to Tiffany Short. Tiffany, your line is now unmuted. Okay, we may need to come back to Tiffany. Let's see, Valerie Mooring. Valerie, your line is now unmuted if you'd like to ask a question.
Yes, thank you. In regards to the EUCs being applied to those individual reporters for 2020, will that mean, or what can we expect as far as for those successful reporters and those that are above the exceptional performance in their MIPS reporting? So I know we do expect some minimal positive adjustments, but I'm just curious if you guys have any information you can share on how that affects those positive adjustments for those that were able to report successfully. Thank you.
Thank you for the question. Yes, so we don't have any specific information or data, obviously, at this point. However, I think given that the program is required to be budget neutral, we don't anticipate higher than we've seen in the past positive payment adjustments, just given that the number of clinicians that will be automatically reweighted to 0 for neutral. But we don't know definitively at this time.
Thank you, Katie. All right, and then moving to our next attendee. So Elizabeth Ashley Thomas, your line is now unmuted if you'd like to ask your question. And Elizabeth, you may be on mute. Okay, we can come back to Elizabeth at a later time, but we will go back to the questions box. Just as one quick reminder, if you would like to ask a question, please submit it using the questions tab or raise your hand and we will unmute your line.
And while we're waiting for somebody else to call in or submit a question, this is Katie. I just wanted to follow back up with the person that asked about the claims reporting. So we do have an FAQ on our COVID-19 page. It's actually the very first one, but I'll read it here while so you have to go look for it. But the question would be, we already reported our quality measures through Medicare Part B claims for our clinicians in 2020. Can we complete an extreme and uncontrollable circumstances exception application? So like I said previously, we're applying the auto policy to all individual MIPS eligible clinicians. So if you're an individual clinician, you don't need to submit an application for individual clinicians. However, we automatically calculate a quality score at group level for small practices that submit Medicare measures. So if you don't intend to submit additional data as a group, we recommend that you submit an extreme and uncontrollable circumstances exception application for the group. If your group is approved for reweighting in all 4 of the performance categories, and you don't submit any other data, your group's final score would be equal to the performance threshold. So you'd receive a neutral payment adjustment. Thank you, Katie.
And Katie, we did get a couple questions. Do you mind just restating for the group the best email for attendees to contact if they have questions related to the quality payment program?
Sure, our QPP Service Center. So if you go to qpp.cms.gov, that's where you can find all of our resources and information. And always at the bottom of the page is how to contact CMS. So there's a phone number. The email is qpp@cms.hhs.gov. And they are open Monday through Friday, 8 a.m. to 8 p.m. And I'll just read the phone number for folks. It's 866-288-8292.
All right, thank you. And on a similar note, Drew, we did just receive a question, and this attendee is asking if they have questions or issues with submissions for the Medicare PI program, who or where should they reach out to for assistance?
They can submit a ticket through the QualityNet help desk, or they can, since there's only about a day left, they could email me directly. And my email address is andrew.morgan@cms.hhs.gov.
Thank you, Drew. And we will go back to the phone line. So Yi Hoffman, your line is now unmuted if you'd like to ask your question.
Hi, can you hear me? Can you hear me?
Yes, we can hear
Great.
you.
At the beginning, I think I heard that for promoting interoperability in 2023, it sounded like you were saying that providers can only use the Cures Update 2015 edition, so the new one. Has that been specified in PI rulemaking?
Thanks for your question. It has not appeared in the IPPS final rule at this time, simply because of when the kind of calendar year rules go out between IPPS and PFS. So what we ended up doing, it wasn't ideal, but as mentioned, we did put a rider for the IPPS program included into the PFS final rule. So it does cover and is applicable to the Medicare Promoting Interoperability Program, except it's kind of riding along and was included in the PFS rule from last year. You can definitely look forward to, although the NPRM is not out yet for the 2022 IPPS proposed rule, you can certainly look forward to seeing more information included there, but it will essentially be a reminder and a point to kind of say, FYI, please look back at the PFS rule, which will have the majority of the information. So you can get a sort of a head start, an early look in by looking at that PFS rule. But yes, we do kind of apologize for the way that rolled out. It was a bit out of our hands. However, again, as mentioned, we kind of wanted to put it out there as soon as possible, as clear as possible, and then just keep doing these sort of educational awareness campaigns, as well as including information in the next IPPS rule to further clarify. Thank you.
Gotcha. So just to make sure I understand, providers reporting PI, and is that applicable to both MIPS PI and hospital PI for 2023 must use the updated Cures edition?
Yes, that is correct. There were different sections
Okay.
that covered both, but yes.
Got it. Thank you.
Thank you.
Okay, great. And then we'll go back and try Tiffany Short. Tiffany, your line is now unmuted if you'd like to ask your question.
Sure. Can you hear me now?
Yes, we can hear you.
Awesome. So with the quality benchmarks for the QPP program, the quality benchmarks for 2021 came out, and there were some measures that were suppressed from 2019 that no longer have benchmarks. And then we also had some other ones that had no indication that they were going to be having a removed benchmark or that it would be topped out or anything like that. And measures like 431, but now they don't have a benchmark. There's no indication of why that is. Is there? Do you have any idea when we might have an update on the ones that the measures that had a suppressed? They were previously suppressed and now there is no benchmark, or the ones that there's just no reason and they don't have a benchmark?
Hi, thanks for the question. And is it specifically just 431 that you had the question about, or were there other ones you weren't sure about?
Well, so the measures are the influenza vaccination measure 110, 113, 134, 226, 238, 317, 418, 431, and 439. Pretty much, except for the 113 and 134, they were pretty much across the board. The benchmarks were removed. But specifically for the 431 and 226, at 238, those had there was no suppression or any indication indicating that they should have a benchmark removed. So we're just trying to understand if maybe it's just in the pipeline, they're still being researched and we're just not aware, or if the benchmarks are completely removed.
Okay, and I know we recently put out the measure suppression list, and I think it gave, I'm trying to pull it up, it gave more details on which measures were suppressed and why. And I thought it had some benchmark information in there as well. So I'm going to see if I can pull up more information while we're talking, but you can definitely call the QPP Service Center and ask them for more specific details, because they will connect you to our measures contract team that would be the ones that would be calculating the benchmarks. So they would definitely be able to give you more detailed information.
Okay, yeah, we've contacted them and they didn't know or weren't able to provide us any information outside of what was on the benchmarking spreadsheet, and that was pretty much it.
Okay, was it? Do you know? Because was it escalated through the service center up the second level of service center, or did they not? They might not tell you.
Yeah, I'm not sure. I think honestly, I think we may have kind of given up on it.
Okay.
We weren't getting anywhere. Yeah.
Okay.
I think we did talk to Tier 2 though.
Okay. I'm just
trying
to see what. Okay. I didn't know what they would have said if we had anything additional we'd be able to share. And was it Hillary?
Tiffany Short.
Tiffany Short.
Yes.
I will catch them team. Do you have Tiffany's contact information? And then I can follow up offline.
Yes, we can share that with you after the call, Katie.
Okay, cool. Thanks. And Tiffany, I can't promise I will give you more information, but I will definitely check with our team internally, our measures team, to make sure that whatever you receive from the service center is definitely the most information we have.
Sure, yeah, that would be great because basically we have what happened is three to four out of the most used ECQM measures, the benchmarks were removed. So for a lot of providers, there is no other option. And you know, if we continue reporting the way that we are without having that answer, we are not going to pass. So
Okay.
and so that would be very helpful.
Okay. Yep. I'll get you in touch with the right folks. Thanks.
Thank you so much, Katie. And I believe we only have a couple more minutes left. So I think that concludes our Q&A for today. So Derek, I will turn it back over to you to close the call.
Thanks, Haley. Thank you for joining us today. Thank you all for joining us today. CMS will share the slides from today's forum in the coming days. In the meantime, if you have any specific questions, please email cmsqualityteam@ketchum.com. The next CMS Quality Programs bi-monthly forum is tentatively scheduled for May. The CMS will share more information in the next forum when it becomes available. Have a great afternoon, everyone.